you talk about other practitioners like ENT or specialists that might be, this patient is presenting with this syndrome, what should they do when they've ruled out a stroke? Maybe they've ordered an MRI and it doesn't come back with any evidence of a stroke. What should be their next step?
Yeah, so of course, early referral to neurology is very important. I think it's important that all clinicians become, to a degree, familiar with these disorders. Often, spinal fluid testing is very, very helpful because when looking at the spinal fluid analysis, you can determine the presence of inflammation, inflammatory markers. You can look for specific biomarkers such as antibodies that can be in the spinal fluid. So having a low threshold to keep these conditions, even though they're rare, but keep them in mind and in the differential diagnosis, and have a low threshold to look at the spinal fluid in patients that are presented with especially a combination of neurologic symptoms for which no specific cause has been found yet.
Okay, and what should the referral process look like if they're not able to identify a different type of condition and they're continuing?
So yeah, I think ideally an evaluation by a neurologist to do a comprehensive neurologic assessment and define what syndrome does the patient have. Does this fit with a known paraneoplastic syndrome? Because we know him very well. And of course, if that's the case, then pursuing the workup that will include looking at the spinal fluid, looking at the blood biomarkers. I think that's a big unmet need because it's challenging at the beginning. At the onset of the symptoms, patients may not have essentially a very significant abnormality on their exam, so it can be very tricky at the onset. But it's that really degree of suspicion that will allow patients to be diagnosed early.